So thank you everyone for joining today's education event. Thanks for taking the time out of your day to join us. I'm just going to quickly go through how today's session will work and a bit of an agenda. So we'll have a quick welcome and orientation before I hand over to our pharmacists who are going to be talking to you today. And then we're going to have a Q&A session where you'll have the opportunity to ask questions for the pharmacists, and then we'll have a little chat about next steps and close today's session. So just a bit of an orientation to make sure everyone gets the most out of today's session. We are going to ask that you have the opportunity to submit questions. So you can do this using the Q&A function, which can be found along the top panel of the Teams toolbar at the top here. I've circled it here. And you can submit questions at any time during the session. But what we'll ask is that we'll wait until the end Q&A session and we'll read these out for the pharmacist to answer. And I also appreciate that not everyone wants to use the Q&A function. So if you'd prefer to ask a question verbally, please just do this by using the raise your hand function here. And what I'll do is I'll be able to unmute you so that you can ask your question. We've just made sure that everyone is muted throughout the session just to make sure everyone can hear and everyone can make the most out of today's session. Just a quick note on confidentiality and recording. So please remember that this is a group education session and not a private consultation. So please do avoid sharing any personal or confidential medical information today. This session is being recorded so that we can upload a recording of the presentation onto our website, but the Q&A session will not be included in this recording. So what I'll do now is I'll hand you over to our pharmacists who will be leading the presentation today, Patrick and Rachel.
Hi, my name is Petra. I'm one of the pharmacists in here and Bristol Medical. So today what we're going to do is we'll spend a few minutes to have a look of what cholesterol level is, and afterwards we'll give you a brief idea of how we can reduce the cholesterol level by either lifestyle or in combinations with medication. So what is cholesterol? So cholesterol is a type of fat in the body which produced in the liver. So we need to think about cholesterol level is a building block, and the body is our house. So we need to have cholesterol to build our house. So what it can help is it can help to build stronger cell and also our hormone. However, there's a balance of high level and low level. So too much is definitely bad. So if you see on this picture, you can see, think about it's a water pipe. So if too much fat in the blood vessel, it will make the blood vessel clot. Hence, it can cause other cardiovascular diseases such as heart attack or stroke. So cholesterol there are two types of cholesterol. So we have got good cholesterol and also bad cholesterol. So let's have a look of this video and see what they said. So let's go to the next slide. So of course, this slide will be on our website, so you can always go back and have a read through the videos. So next is how we can reduce the cholesterol by what can cause high cholesterol. So if you see on the left-hand side, these are the things that we cannot change. So these are what we call non-modifiable risk factors. So how it affects is as we age, the cholesterol level could go higher. If we are biological male, there's a more tendency that because of the lifestyle, that the cholesterol level will be raised. Also, after menopause, because of the hormone has been changed, it can also push up the cholesterol level. And of course, if you have got a family history of high cholesterol, for example, like young or other young onset of heart attack or stroke, it can also reduce the cholesterol level as well. So on the right-hand side, these are things that we can change. But if we are having these things, it can also increase our cholesterol level in our body. So for example, high saturated fat via junk food or junk food like McDonald's, like burgers, chips, that kind of things can increase the cholesterol level. High consumptions of alcohol can also lead to high cholesterol level, along with smoking, inactive lifestyle, and if we are overweight or obese, these people can have a tendency of high cholesterol level as well. So how we can reduce our cholesterol level, there are two options. We can focus on lifestyle plus or minus medications. So with regard to lifestyle approach, we need to adhere with a balanced, healthy lifestyle. So what it means is we need to have at least 5 portions of different fruit and vegetables per day, 2 portions of fish per week. At least 1 portion of this fish would need to be oily fish, for example, mackerel or salmon. We need to make sure that we should reduce our saturated fat content, like substituting butter to olive spread, using semi-skim milk rather than a full-fat milk, and also using olive oil. We should also aim to reduce our alcohol consumptions to a maximum of 14 units per week. So 14 units is, for example, it will be roughly 7 glasses of wine or 7 pints of beer. And also we should reduce or stop smoking, which I will show you on the next slide how we can help you with it. And we need to make sure that we need to keep ourselves active. We should be aiming for roughly 20 to 30 minutes of physical activities per day. So how Bridgeview Medical can support you? So we have got in-house health wellbeing coach and also dietitians. So health wellbeing coach and dietitians can offer support to patients and to manage their lifestyle, to give them motivations and set up personalized goals to achieve and change their behavior. Also, the dietitians can support patients with dietitian's advice, which can help them to reduce weight and etc. So and also we have got social prescribers as well. These group of clinicians can help patients to connect with their community to manage their health and well-being. All of these information can be looked through our website. And locally, we have also got self-referral services. So Fit Robin and also Busybody, they are both 12 weeks in-person / online program to help patients to lose weight and give them information about healthy eating. So you can self-refer to these 2 services. And also Smoke-Free Bristol, they will help the smokers to give them one-to-one support to help them to achieve quit or stop smoking.
Hi, I'm just moving on to the next slide. My name is Rachel. I'm one of the other pharmacists at Bridgeview Medical. We're going to talk. The other approach to reducing your cholesterol, of course, is using the statin medication, which is why you're here today, and also the fact that we look at your overall risk of cardiovascular disease. So that's your risk of heart attacks and strokes in the next 10 years. Now, this is only an estimation, so it's based on statistics and evidence, but it is only a sort of best guess, as it were. So, this is to allow us to start medication that will prevent a problem in the future. And with the Q risk, we look at different factors. So that will include your age, your sex, your ethnicity, your smoking status, weight, your cholesterol profile, blood pressure, and also family history. So family history is incredibly important when we're estimating people's risk of heart attacks or strokes. So these charts show what we mean by risk and what we mean by so we talk about 10% risk a lot because this is the level at which this is the threshold which we decide that people would benefit from taking statin medication to lower their cholesterol. So to put this into context, really what it means is if there was a room of 100 people, we know that 90 of those people are not going to have a problem. They're not going to have a heart attack or stroke, but we know that 10 people will. Okay, we just don't know who those 10 people are. So if somebody didn't take a statin, then there will definitely be 10 out of those 100 people that would have a heart attack or stroke. So with a statin, we can help lower that risk. So we can actually save 4 people. So you see that in the yellow circles there, we can save 4 people from having a stroke or a heart attack. However, 6 people will go on still to have a stroke or heart attack, even though they're taking a statin. So just to emphasize that even if you are taking a statin, it isn't going to eliminate your risk completely, okay? So it is important also to make the lifestyle changes. We can see on the next chart that actually when your risk is higher at 20%, that more people benefit from taking a statin. So 7 people will be saved from having a heart attack or stroke, okay, out of 100 people. So that number of people saved from having a heart attack or stroke in the next 10 years will increase as your risk increases. And of course, our risk increases as we get older. So which statin do we prescribe? Now, I'm sure you probably know someone or have heard about this medication called atorvastatin. It's our sort of first choice now, and it's the most effective, and it has the most evidence behind it. So it's been tried and tested for many, many years. So there are some people that wouldn't be suitable for this. So that would, of course, be people that are pregnant or breastfeeding, also people that have got sort of active liver diseases or abnormal liver function tests. So we do like to make sure that we have a baseline liver function test and also a thyroid function test, as well as your lipid profile before we start people on statins. The thyroid function is because sometimes abnormal thyroid levels can raise cholesterol. So we are aiming for your cholesterol levels to be reduced by 40%. So that's your bad cholesterol levels that needs to be reduced by 40%. So that's the non-HDL that we heard about earlier. So what we do is we look at your cholesterol profile 3 months after you've started the statin, and then periodically after that. We also check your liver function at 3 months and 12 months. There's obviously lots of questions about side effects because people are concerned about taking new medication and what might, how that might make them feel unwell. So what we usually find is that atorvastatin is very well tolerated. However, there are some people that do experience side effects that can be mild and wear off over time. So things like constipation or diarrhea, headaches, nausea. Sometimes people get muscular aches and pains, cramps or tenderness. So if you find that it's troublesome for you, or it's very severe or not wearing off, then we can talk, have a discussion about that and decide whether to stop the statin or try an alternative. So please let us know if that becomes a problem. So what we'll do now, now that you've you know, heard our presentation, heard a little bit about statins, we'll obviously have our Q&A session. It's an opportunity, so do have a think. If you've got any questions, we can go through those now. But after that session, then we will be sending you a text message to ask you whether you would like to start atorvastatin 20 milligrams. Then what we'll do is myself and Patrick will look through your notes to make sure that you have all the up-to-date tests. If you haven't, we will send you a blood test booking link so you can book that blood test. If you have had all the up-to-date blood tests, then we'll go ahead and issue a prescription and we'll let you know. Okay, and also if you do decide that it's not for you at this moment in time and that you don't want to start treatment, then do let us know. Okay, we will obviously document that on your medical notes, and it is obviously absolutely your choice and your decision, because you may choose to just try lifestyle changes instead, or for a period of time. But do, of course, if you change your mind at any point in the future, please don't hesitate to get in contact with us via the clinic form, and we will certainly get in contact with you. Okay, because all of this is about preventing a problem in the future, and that's what we aim to do. Thank you. Thanks for listening today.